people, and it's gone on far too long.
So I'm Janelle Lewis. I'm a mental health case manager. I've been in mental health services for 20 years in Thurston County and Grace Harbor County. We're community in crisis and trauma. I'm going to apologize for all my statistics. There are 2,000 people homeless in Grace Harbor, 1,000 of them in Aberdeen alone. We have the second highest rate of suicide and drug overdose in all the counties in Washington. We have the worst health in the state and the lowest life expectancy of the people. People in this county die 5 years younger than anywhere else in our state. 18.6% of the population is below the state poverty level in this county. We have the highest rate of unemployment in the state, and the annual wage is $9,000 below that of the state average. 1 in 5 high school students are using drugs. 25% of 10th graders that were polled thought about suicide. 41% reported depression. 29% reported being bullied. We have limited beds for the homeless. We have about 129 beds and 1 homeless camp that is always being forced out that supports 130 families. We have no community centers for the youth or people with mental health issues. We have limited drug and alcohol treatment and no detox or treatment centers in this county that accept the state medical. We have a mental health BHO. They're the people that give us the money for mental health and drug and alcohol treatment. They're sitting on $5 million surplus that belongs to this community. $5 million to help treat people with mental health and drug and alcohol treatment, but they are not putting that back into the community where it belongs, and we are at risk of losing it back to the state if they don't use it. We have no mental health professionals in Grace Harbor, so that people in mental health crisis have to wait for someone 2.5 hours away to get here just to see them. We have a severe lack of public investment in health care, including mental health, and it fuels the harbor's dual crisis of suicide and opioid overdose. We have to drive our clients 5 and 6 hours away for inpatient drug and alcohol treatment. Sometimes they're off their meds or coming off of whatever substance they're on, and they're a little unstable to be in a car. They're in a car with 1 mental health professional all the way up past Bellingham, who's trying to get through traffic and deal with a lot of stuff. So it's kind of dangerous sometimes. Our hospitals are not kind to the mentally ill or people with drug and alcohol illnesses, and they're just people that need help. They have to wait 4 to 6 hours sometimes just to be seen, and now that someone has to come from 2.5 hours away, it can take half the day, it can take all night. I've sat all day and all night to get them a bed if there's one available and one can be found. A lot of times they're sent back into their homes or back into the community where they're unstable, and this can lead them to becoming more dangerous to themselves. Most of my clients will not go to the community hospitals here because they know they won't be treated well, and they won't really get the help that they need. I have a suicidal client that I took 6 times in a month and a half to either the hospital or the crisis center, and they never found him a bed. During that time, we just had to work with his primary doctor, and I was seeing him weekly, just trying to get him through the symptoms. This is compounded by our lack of investment in affordable health care, which leaves people vulnerable to the trauma and violence of living on the streets. You can't recover from drug and alcohol and mental health issues without a roof over your head. Without housing, young people are vulnerable to exploitation. I have a client who was a victim of domestic violence. We looked for 6 months for housing while he stayed in that domestic violence situation, and he got more and more depressed and more desperate and suicidal. And he would tell me, I see empty houses everywhere. Why can't I just rent one of those? This client suffered a heart attack 3 days before Christmas, and he died. The state denied his doctor's request to see a cardiologist, and they were in the process of attempting to get that pushed through when he passed away. This could have saved his life. He was only in his 40s. And he didn't go to see doctors regularly because of how they treated him. They treated him really meanly. I was there with him and actually called the doctor to task on that one. We have people dying without health care. 41 million Americans in this country live below the state poverty level. 3 million Americans who are homeless, and 7.4 that are on the brink of homelessness in our nation. But we're one of the wealthiest nations in the world, and we're not helping the most in need. The people experiencing homelessness, addiction, and mental health issues are the truest experts on these issues. We need them to lead this movement in our justice work for it to be successful. Everyone here today can do their part. You can vote and support people who support the needs of those in our community. Get involved in city council. Get involved in the county commissioners, who oversee our BHO, by the way. We can all register to vote for people who are for the people and in need, and not big money in the 1%. We can encourage the state to close tax loopholes so we can fund all of the services that are needed in our state and communities. We need to have a plan to put money into health care. Mental health and drug and alcohol treatments are real solutions for our housing crisis that help the people in desperate need in this community. Youth centers, no barrier shelters, day centers for seniors and the mentally ill. People have overcome worse with less. We can overcome this too. We need to mobilize, we need to stand up and fight back. We all need to stand together. We have the power to change our communities and the world we live in and fight back against the 1%. We have been a little too quiet for a little too long, and it's gone on for far too long, and we won't be silent anymore. Thank you.
Somebody's hurting our people, and it's gone on far too